We're going to be considering common illnesses that can result in permanent deafness. The World Health Organization note that immunization is a proven tool for controlling and eliminating life-threatening infectious diseases and is estimated to avert between 2 and 3 million deaths each year. It is one of the most cost-effective health investments with proven strategies that make it accessible to even the most hard-to-reach and vulnerable populations. Measles is a highly contagious disease which is caused by a virus. This results in a high fever and rash. Measles infection can lead to blindness, encephalitis, deafness or death. And measles is very easily spread. The WHO reported that there were 145,000 deaths as a result of measles in 2013. This is despite the fact that 84% of children had received one dose of measles vaccine by their second birthday. This was an increase from 73% coverage in 1996. 148 countries include a second vaccine dose as part of their routine immunisation programme. The Democratic Republic of Congo, Ethiopia, India, Indonesia, Nigeria and Pakistan together account for 28% of the global population in 2013, with over 70% of estimated global measles deaths. Approximately 30% of measles cases have one or more complications. These are most serious in children under the age of 5 years and adults over the age of 20 years. The effect on the auditory system is usually to cause a conductive hearing loss, occurring in 7% of cases. However, where there is central nervous system involvement, measles can also result in a permanent hearing loss. Mumps is a highly contagious virus. It can lead to viral meningitis. WHO report that mumps vaccine has been introduced to 120 countries by the end of 2013. Mumps has been reported to be one of the major causes of acquired hearing loss. Hearing loss can occur at any time during the illness and is not related to the degree of facial swelling. Rubella or German measles. Whilst the virus usually causes a mild illness in children, the effect of the infection during pregnancy can result in fetal death or congenital rubella syndrome, associated with defects in the brain, heart, eyes and ears. About half of rubella cases in adults are so mild there are no symptoms. But about 9 in every 10 unborn babies exposed to rubella during the first 10 weeks of pregnancy will have major congenital abnormality. Birth defects included with congenital rubella syndrome include deafness, blindness, heart defects, intellectual disability, impaired growth and inflammation of various organs such as the brain, liver or lungs. Deafblind children and adults require individualised support in education, but also in daily living. Global coverage relating to rubella immunisation in 2013 was estimated to be only 44%. 2.5 million individuals live with deafblindness worldwide. Most experience high levels of poverty, social exclusion and limited access to healthcare, education and social welfare. Given appropriate support, individuals who are deafblind can not only contribute to society, but also lead a full and interesting life. Meningitis. The World Health Organization note that meningococcal meningitis, a bacterial form of meningitis, is a serious infection of the thin lining that surrounds the brain and spinal cord. The extended meningitis belt of sub-Saharan Africa stretches from Senegal in the west to Ethiopia in the east, covering 26 countries, and this has the highest rate of the disease. During the 2014 epidemic season, 19 African countries implementing enhanced surveillance reported 11,908 suspected cases, including 1,146 deaths. Bacterial meningitis is the most common form of acquired sensorineural hearing loss, in other words, permanent hearing loss. It accounts for between 60 and 90% of all acquired cases of postlingual, late onset, sensorineural hearing loss, permanent hearing loss. The degree of deafness is usually profound. In high-income countries, children are fast-tracked for cochlear implantation. However, this is simply not an option in low and middle-income countries. Despite significant gains made by the global immunisation programme, an estimated 21.8 million infants worldwide are still missing out on basic vaccines. Close to 70% of these live in the Democratic Republic of Congo, Ethiopia, Nigeria, South Africa, Kenya, Mexico, India, Pakistan, Vietnam and Indonesia. The World Health Organization suggests that regional and local inequalities result from limited resources, competing health priorities, poor management of health systems and inadequate monitoring and supervision. Those living in poverty and in remote rural areas or living in areas torn by strife are at most risk.